Hello everyone. Today in this video we will be learning about the thoracic vertebrae. The thoracic vertebrae are 12 in number and they lie in the thoracic region of the vertebral column. The thoracic vertebrae are classified into typical thoracic vertebrae and atypical thoracic vertebrae. Typical thoracic vertebrae are those vertebrae which present common features. The second to eighth thoracic vertebrae are included under typical thoracic vertebrae. The atypical thoracic vertebrae are those vertebrae which present special features. These include the first, 9th, 10th, 11th and 12th thoracic vertebrae. So the 12 thoracic vertebrae occupy the thoracic region of the vertebral column starting from here till here. So here comes the T1 thoracic vertebrae and here comes the T12 thoracic vertebrae, and as you can see the size of the vertebrae increases gradually from above downwards. So here comes the T1 thoracic vertebrae and then comes the T2 thoracic vertebrae, the T3 thoracic vertebrae, the T4, T5, T6, T7, T8, T9, T10, T11 and finally the T12 thoracic vertebrae. So here comes the second thoracic vertebrae and T2, T3, T4, T5, T6, T7, T8. So the second to eighth thoracic vertebrae called as the typical thoracic vertebrae, and you can notice that these vertebrae they present common features. Their features are almost similar. And now the atypical thoracic vertebrae are the first, then 9th, 10th, 11th and 12th thoracic vertebrae. And you can see that these vertebrae they have special features. So now we are going to learn the characteristics of a typical thoracic vertebra. So here you can see the typical thoracic vertebra. The main parts of a typical thoracic vertebra are the body, the vertebral foramen, the pedicles, the laminae, the superior articular processes, the inferior articular processes, the spinous process and the transverse processes. Now let's identify each of these parts. First, the body of vertebra, the body of thoracic vertebra. Here comes the body of thoracic vertebra. This bony mass is the body of thoracic vertebra. And next is the vertebral foramen. Here comes the vertebral foramen. And then the pedicles. Here are the pedicles, the two pedicles which connect the body with the neural arch. And then comes the laminae. Here are the two laminae, the two laminae. And then the superior articular processes. Here are the two superior articular processes which project upwards, the superior articular processes. And then comes the inferior articular processes which are projecting inferiorly. Here are the two inferior articular processes. And then here comes the spinous process which projects backwards and downwards. Here is the spinous process or the spine of thoracic vertebra. And finally, here are the two transverse processes which project laterally. Now, let's see each of these parts in detail. First of all, about the body. So here comes the body. This is the body of thoracic vertebra. This bony mass is the body. The shape of the body resembles that of a heart. The shape of the body resembles that of a heart of playing cards. So you can notice that the shape of the body, it is like that of a heart. Now, the anteroposterior measurement is slightly more than the transverse measurement. So, about the shape of the body, it resembles that of the heart of playing cards, and the anteroposterior measurement is slightly more than that of the transverse measurement. Okay, so when you hold the bone in anatomical position, so this measurement is the anteroposterior measurement and this is the transverse measurement, and you can notice that this measurement is slightly more than this measurement. So the anteroposterior measurement is slightly more than the transverse measurement. Okay. Now the body bears two facets on either sides. and these two facets are for the head of ribs, and these facets are known as costal facets. Okay, so here is one side of the body and here is the other side of the body. Okay, so these are the sides of the body. On each side the body bears two facets called as costal facets. So one facet is near the upper border of the body and the other facet is near the lower border of the body. Okay, again on this side you can see a facet over here, there is a facet here and there is another facet here, and this facet is near the upper border of the body and this facet is near the lower border of the body. Okay, and these two facets are called as costal facets, and the facet which is located above this one is named as superior costal facet, while this one, the facet which is located below, is named as inferior costal facet. Okay, so altogether there are 4 costal facets on the body, 2 on each side. So there is one superior costal facet and one inferior costal facet on one side, and there is one superior costal facet and one inferior costal facet on the other side. So in this way the body bears 2 costal facets on each side, and these are the superior costal facet and the inferior costal facet. Superior costal facet and the inferior costal facet. So you can notice these two facets. So here you can notice a small depression, and that is the superior costal facet, and here there is another depression and that is the inferior costal facet. So here is the superior costal facet and here is the inferior costal facet, and these costal facets, they articulate with the head of ribs. You know that the ribs articulate with the thoracic vertebrae, the head of the ribs articulate with the thoracic vertebrae. So the head of the ribs articulate at this facets present on the sides of the bodies of the thoracic vertebrae. Now the superior costal facets, they lie near the upper border of the body. So here is the body of thoracic vertebrae, and this is the upper border of the body, and this is the lower border of the body, and the superior costal facet, it lie near the upper border. So these are the 2 superior costal facets which lie near the upper border of the body, and these superior costal facets, they articulate with the head of numerically corresponding ribs. Okay, the superior costal facets articulate with the head of numerically corresponding ribs, and then comes the inferior costal facets. Here is the inferior costal facets, and inferior costal facets, they lie near the lower border of the body. So here is the lower border, and the inferior costal facets, lie near the lower border, and the inferior costal facets, they articulate with the head of ribs one number more than the number of the vertebrae. So the inferior costal facets articulate with the head of ribs, and the number of the ribs will be one number more than the number of the vertebrae. So the inferior costal facets articulate with the head of ribs one number more than the number of vertebra. So these are the inferior costal facets. So the superior costal facets articulate with the head of numerically corresponding ribs, and inferior costal facets articulate with the head of rib one number more than the number of vertebra. Here, what do you mean by numerically corresponding? So here you can see this is a typical rib, and numerically corresponding means the same number of vertebra and rib. Okay. For example, the superior costal facet of 6th thoracic vertebra will be articulating with the head of 6th rib. Okay. Meanwhile, the inferior costal facets articulate with the head of rib one number more than the number of vertebra. For example, the inferior costal facet of 6th thoracic vertebra will be articulating with the 7th rib, and the inferior costal facet of 7th thoracic vertebra will be articulating with the 8th rib and so on. Now let me show you how the heads of ribs articulate with the costal facets on the bodies of the thoracic vertebrae. Now here is a typical rib and here is the head of the typical rib. This portion, this part is called as the head of typical rib, and the head of typical rib articulates with the sides of the bodies of the thoracic vertebrae, and this head consists of two facets, an upper smaller facet and a lower larger facet. So here you can see two facets, and here is a smaller facet which is present in the upper part, and that is called as the upper smaller facet, and here there is a larger facet which is present in the lower part, and it is called as the lower larger facet. So upper smaller facet and a lower larger facet, and the lower larger facet, it articulates with the body of the numerically corresponding vertebra, while the upper smaller facet articulates with the vertebra above. So the larger lower facet articulates with the body of numerically corresponding vertebra, while the upper smaller facet articulates with the vertebra above. Now let me explain this to you. See, the whole of the head of rib articulates to notches in between the vertebra. That is, see, suppose these are the bodies of the thoracic vertebrae, and there are notches present in between the bodies of the thoracic vertebrae on either sides, and these notches are formed by the superior and inferior costal facets together, and the whole of the head of rib articulates to these notches like this. Okay, so the heads of ribs articulate to notches in between the bodies of the vertebra, and these notches, each of this notch is formed by the superior and inferior costal facets together. That is, here is the inferior costal facet of this vertebra, and here is the superior costal facet of this vertebra, and this superior costal facet and inferior costal facet together forms this notch. Again, this is the inferior costal facet of vertebra above, and this is the superior costal facet of vertebra below. Okay, so the inferior costal facet of vertebra above together with the superior costal facet of vertebra below forms a notch to which the heads of ribs articulate. For example, let's consider the thoracic vertebrae T6, T7 and T8. So consider these are the bodies of the thoracic vertebrae T6, T7 and T8, or rather the cross sections through the bodies of the thoracic vertebrae, and in between the bodies you have the intervertebral discs present. So the intervertebral discs are found present in between the bodies of this vertebrae. Now the costal facets are found on the sides of the bodies of the vertebrae. So here comes the superior costal facet of the T6 thoracic vertebrae, and here comes the inferior costal facet of the T6 thoracic vertebrae. Again, here comes the superior costal facet of T7 thoracic vertebrae, and here comes the inferior costal facet of T7 thoracic vertebrae. Again, here comes the superior costal facet of T8 thoracic vertebrae, and here comes the inferior costal facet of T8 thoracic vertebrae. Now you can find notches in between the bodies of the thoracic vertebrae, and to this notches the heads of the ribs articulate. Now let's see how this articulation happens. Now here is the posterior end of the rib with the head. So here is the head of the rib, and head of rib consists of two facets, an upper smaller facet and a lower larger facet. So here is the upper smaller facet and here is the lower larger facet, and in between these two facets there is a elevation called as crest. Now the upper smaller facet articulates with the inferior costal facet, while the lower larger facet articulates with the superior costal facet. Okay, so here is the upper smaller facet. It articulates with the inferior costal facet, while the lower larger facet articulates with the superior costal facet. Now the lower larger facet articulates with the superior costal facet of the numerically corresponding vertebra. Okay, so numerically corresponding vertebra means this rib is the seventh rib. Okay, so the lower larger facet of the head of seventh rib will be articulating with the superior costal facet of T7 vertebra. Okay, now when you consider the rib here, here also the next rib articulates, and here is the upper smaller facet and here is a lower larger facet, and this rib will be the eighth rib. Okay, so the lower larger facet of eighth rib will be articulating with the superior costal facet of T8 vertebra. So that is how the lower larger facet will be articulating with the superior costal facets of the numerically corresponding vertebra. Okay. Now talking about the upper smaller facet, the upper smaller facet articulates with the body of vertebra above. So that is the upper smaller facet of seventh rib articulates with the inferior costal facet of the vertebra above. So the vertebra above means the vertebra just above T7, that is the T6 vertebra. Okay. So again here the upper smaller facet of eighth rib will be articulating with the inferior costal facet of the vertebra above, that is the T7 vertebra. Or in other words, we can say that the superior costal facets articulate with the head of numerically corresponding ribs. That is, here you can see the superior costal facet of T7 vertebra is articulating with the head of seventh rib, while here the superior costal facet of T8 vertebra is articulating with the head of eighth rib. Now the inferior costal facets articulate with the head of ribs one number more than the number of vertebra. So here the inferior costal facet of T6 vertebra is articulating with the head of seventh rib, that is one number more than the number of vertebra. So the number of vertebra is T6 and the number of rib is 7. Again, here is the inferior costal facet of T7 vertebra and it is articulating with the head of eighth rib, that is one number more than the number of vertebra, T7 and eighth rib. So this is how the costal facets articulate with the heads of ribs. The upper smaller facet of the head of rib articulates with the inferior costal facet, while the lower larger facet of the head of rib articulates with the superior costal facet. The lower larger facet of the head of rib articulates with the superior costal facet of numerically corresponding vertebra, while the upper smaller facet of the head of rib articulates with the inferior costal facet of vertebra above. And finally, the intervertebral discs come here. Okay. So the intervertebral discs, it corresponds with the crest of the head of rib. So the intervertebral discs corresponds with the crest of the head of rib. So this is how the heads of ribs articulate with the sides of the bodies of the thoracic vertebrae. Now here are the bodies of all the thoracic vertebrae and the heads of ribs will be articulating in between them. Now, what you have to note is that the 12th rib articulates in between the T11 and T12 vertebra, while the first rib articulates solely to the superior costal facet of T1 vertebra. Now, here are two thoracic vertebrae and a typical rib, and we have seen that the head of the rib articulates to notches present in between the bodies of the thoracic vertebrae, and the articulation occurs like this, in this way. That is, here is the inferior costal facet and here is the superior costal facet, and here is the head of the rib with the upper smaller facet and the lower larger facet, and you can see that the upper smaller facet articulates with the inferior costal facet of the vertebra above, and the lower larger facet articulates with the superior costal facet of the vertebra below. So, this is how the head of the rib articulates with the bodies of the thoracic vertebrae. Next, let's look into the vertebral foramen. So, here is the vertebral foramen. The vertebral foramen is smaller in size. So, when you observe the foramen and when you compare it with the foramen of the typical cervical vertebra and all, you can notice that the size is smaller. Okay, so the vertebral foramen is smaller in size and it is nearly circular. You can see the shape is nearly circular. It is almost circular in shape. Then about the pedicles, here are the two pedicles. As you know, the pedicles connect the body with the neural arch, and the pedicles of thoracic vertebra project directly backwards. So, you can notice the direction of the pedicles. They project directly backwards. The pedicles project directly backwards, and the pedicles are attached close to the upper borders of the body. So, you can notice that the pedicles, they are attached close to the upper borders of the body of thoracic vertebra. So, here is the pedicle, and when you observe the attachment of the pedicle, you can notice that the pedicles are attached close to the upper borders. So, see, here is the upper border of the body, and you can notice that the attachment of pedicles is near to the upper border, while here is the lower border and the attachment is a bit far away from the lower border. Okay, so the pedicles are attached close to the upper borders of the body, so that the inferior vertebral notches are of much greater depth. So, see, this notch is known as the inferior vertebral notch, and here is the inferior vertebral notch of this side, the inferior vertebral notch. Inferior vertebral notches are located at the inferior aspect of the pedicles. We have seen about the inferior vertebral notch when we studied the characteristics of a typical vertebra. So, here you can notice that this inferior vertebral notch, it is of much greater depth. You can see that this inferior vertebral notch here, it is of much greater depth. Why? Because the pedicles are attached more close to the upper borders. Okay, so the attachment of pedicles are close to the upper border of the body, so that the inferior vertebral notch are of much greater depth. So the inferior vertebral notch of thoracic vertebrae are of much greater depth because the pedicles are attached close to the upper borders of the body. Now, let's see about the laminae. So, here are the two laminae. These are the two laminae, and laminae, as you can see, they are short, broad and thick. So, the laminae, unlike that of typical cervical vertebrae and all, it is broad. You can see it is broad and they are short. they are shorter, they are short, and they are thick. The thickness is comparatively more. So the laminae are short, broad, and thick. Okay. Now let's see about the superior articular processes. The superior articular processes project upwards from the junction between the laminae and the pedicle. Okay. So these are the two superior articular processes. The two superior articular processes. Superior articular processes project upwards from the junction of laminae and pedicles, and the superior articular facets are present on the superior articular processes. So you can see, you can notice the facets here, the oval facets on the superior articular processes, and this superior articular facets, they face backwards, laterally, and upwards. So hold the bone in an anatomical position and note the direction of the superior articular facets. They face backwards, and they face slightly laterally. Okay, you can see that their alignment is such a way that they face slightly laterally and upwards. Okay, so the superior articular facets, they face backwards, slightly laterally, and upwards. So that's all about the superior articular processes. And now coming to the inferior articular processes. So here are the two inferior articular processes. They are located at the inferior aspect and they project downwards. The inferior articular processes are seen projecting downwards. Now the inferior articular processes consist of the inferior articular facets. So here you can see the inferior articular facets, the oval facets present on the inferior articular processes. These are the inferior articular facets. These inferior articular facets, they face forwards, medially, and downwards. So hold the bone in an anatomical position and you can notice that this inferior articular facets, they face forwards. So inferior articular facets, they face forwards and then slightly medially. So you can notice the alignment of the inferior articular facets are in such a way that they face slightly medially. Okay, they are aligned like this so that they face slightly medially and downwards. Okay, so they face slightly downwards also. So the inferior articular facets face forwards, slightly medially, and downwards. Inferior articular facets face forwards, medially, and downwards. Now coming to the spinous process. So here comes the spinous process. The spinous process, it passes backwards and downwards. Hold the bone in an anatomical position. You can see the spinous process passing backwards and downwards. And the spinous process, it ends in a tubercle. So at the tip of the spinous process, you can find a tubercle. Okay, so spinous process ends in a single tubercle. So this whole thing is the tubercle. This is the tubercle. The spinous process ends in a single tubercle. So that's about the spinous process. Now finally, let's look into the two transverse processes. So the transverse processes are two in number and they project laterally. The transverse processes are of big size. So the transverse processes are of big size when compared to the other vertebrae and they are club shaped. So you can notice the shape, they are club shaped and they face laterally and backwards. So the transverse processes, they project laterally and backwards. So you can notice the direction of the transverse processes. They project laterally as well as backwards. So they project laterally and backwards. Now the transverse process, it arises at the junction of laminae and pedicles. Okay, here is the pedicle and here comes the laminae. So the transverse process arises from the junction of the laminae and pedicles and each transverse process bears a facet on its anterior aspect. Okay, so hold the bone in anatomical position, the transverse process, and here comes the anterior aspect of the transverse process. Here is the anterior aspect of the other transverse process, and on the anterior aspect of the transverse process you can see one facet. So here is the facet present on the anterior aspect of the transverse process, and this is a facet for articulation of the rib. So this facet articulates with the tubercle of the rib. Okay, so here is the other facet, and this facet articulates with the tubercle of rib, and the facet present on the transverse process, it articulates with the tubercle of numerically corresponding rib. So this facet present on the transverse process, it articulates with the tubercle of numerically corresponding rib. So we have already seen that the costal facets present on the body of the thoracic vertebra articulate with the heads of the ribs, and the tubercle of that corresponding rib articulate at this facet present on the transverse process. Now let me show you how the ribs articulate with the transverse processes of thoracic vertebrae. So we have seen that the costal facets on the bodies of the thoracic vertebrae articulate with the heads of ribs, and the transverse processes articulate with the tubercle of rib. So here is the tubercle of the typical rib, here is the head of the typical rib, and here comes the tubercle of the typical rib. So here is how a rib articulates with the thoracic vertebral column. This way, that is, the head of rib articulates with the notch formed by the superior and inferior costal facets present on the sides of the bodies of the vertebrae. Here is the head of rib. It articulates with the notch formed by the superior and inferior costal facets which are present on the sides of the bodies, while the transverse process of the vertebra articulate with the oval facet present on the tubercle of rib. So here you can see the transverse process is articulating with the tubercle of rib. So here is the tubercle of rib, and here is the oval facet present on the tubercle of rib, and this oval facet articulates with the facet present on the transverse process. So here you can see the facet present on the transverse process, and to which the oval facet present on the tubercle of rib articulates. So this is how the articulation of a rib to the thoracic vertebral column comes.